Today, we will talk about drug use and abuse. Now, let us know first, what is drug? Drug is any chemical substance that by virtue of its chemical nature alters the structure and functioning of a living organism. Drug addiction. It is a state of periodic or chronic intoxication produced by the repeated consumption of a drug, natural or synthetic. Characteristics of drug addiction. First, we have uncontrollable craving. This is when the addict feels a compulsive craving to take drug repeatedly and tries to procure the same by any means. Tolerance. It is the tendency to increase the dose of the drug to produce the same effect as to that of the original effect. Addiction. This is when the addict is powerless to quit drug use. Physical dependence. This is when the addict's physiological functioning is altered. Psychological dependence. This is when an emotional and mental discomfort exists to the individual. And withdrawal syndrome. This is when the addict becomes nervous and restless when he does not get the drug. How addiction is acquired. First, through association. This is the tendency of a drug abuser to look for peer groups where he feels being wanted and accepted. Next is through experimentation. This is the tendency of a person to try and explore the effects of drugs due to curiosity or other reasons. And through inexperienced doctors. This is the tendency of doctors and physicians to unnecessarily prescribe drugs. It may also be acquired through habituation, which is the repetitious engagement of drug use, which is closely related to the experience of the euphoric effect of drugs and the relief of pain or emotional discomfort. Toleration, which refers to the necessity to increase the dose to obtain an effect equivalent to the original dose. And dependence, which is the altered physiological state brought about by the repeated administration of the drug. Drug abuse. This is the use of medically useful drugs which have the capacity to alter mood and behavior without the benefit of a prescription. It is also the use of a medically useful mood-altering drug for a purpose different from the one for which the drug has been prescribed. And the use of drugs and substances having no legitimate medical application for purposes other than research. Factors influencing drug abuse. First is depression or social disorders. This can prompt a person to try drugs as a form of self-medication. Genetics and family influence. Children gain genetic characteristics and influence from their parents. Lack of parental supervision. Lack of parental guidance and supervision allows children and teens to make choices with less than adequate information. Peer influence. People who try to fit in will often try drugs that their peers are using to make themselves feel more a part of the group. Acceptance by their friends is a priority. And drug availability. Whether it be from peers and an unstable environment where drugs are prevalent or a prescription from a physician, drugs that are easily accessible will make certain addictions possible. Administration of drugs in the human system. First, we have the oral administration. This is the administration through the mouth, which is the safest and most convenient and economical route. Next is injection. This form of drug administration offers a faster response than the oral method. This makes use of a needle or other device to deliver the drugs directly into the body tissues and blood circulation. Inhalation. This route makes use of gaseous and volatile drugs which are inhaled and absorbed rapidly through the mucus of the respiratory tract. Topical. This refers to the application of drugs directly to a body site, such as the skin and the mucous membrane. And lastly, iontophoresis, the introduction of drugs into the deeper layers of the skin by the use of special type of electric current for the local effect. That would be all. Thank you.